Hello, my name is Dr. MarkAlain, Dery, and I'm the Medical Director of Infectious Diseases and the Chief Innovation Officer for Access Health Louisiana, the largest Medicaid providing clinic system in Louisiana. And I'm co-chair of the ACOI Infectious Diseases Subspecialty Section. Along with the leadership of the ACOI, we want to thank you for all that you are doing as we face this unprecedented time in medicine fighting the COVID-19 virus. Moving forward, and in conjunction with the ACOI, we want to share with you some information as it becomes available, as well as some bright spots as we are seeing so that we all can feel some hope in these trying times. So let's talk about some contact tracing. So contact tracing through our phones. It's been in the news for a few weeks now, and I've wanted to comment on this because it's truly great to see these two tech giants, Apple and Google, who are typically competitors, embarking on this unprecedented joint effort as a collaborative response to developing a contact tracing app. Both companies are working together to create a way to stop community spread of COVID-19. Using Bluetooth technology, individuals who become exposed to COVID-19 will be able to be notified and then provided with instructions on their next course of action. Now, with the goal of protecting user privacy, the companies are also releasing application programming interfaces, known as APIs, that allow contact tracing apps from public health authorities to work across both the Android and the iOS devices, which are essentially iPhones or Apple phones. Now, when the apps are ready for consumers, individuals will be able to opt in to allow notifications to their phones to inform them if they've been exposed to somebody with the virus. They will then be directed as to what to do next. Now, it's important to know that the way this technology is being developed, there will be no capture or release of personal private information. Now, another important thing to note is that with this effort, it is not going to be a commercial venture for either Google or Apple. So I'm excited to see how this technology plays out for effective contact tracing, and I encourage everybody to learn more about it, and especially how it will work on our phones when these apps become available. Now, for healthcare workers, this has the potential to be a key addition to our toolbox so that public health authorities can better manage disease transmission. There are links on this page to read more of. Also, be on the lookout for how to participate when these apps do become available to the public. The other thing to consider here as well is that there are these sorts of apps that are being used around the world. South Korea has been doing a great job of utilizing these apps, and these have been tremendous in helping public health practitioners be able to find and do very efficient contact tracing. So let's talk about, again, another IDSA update. These are great. The Infectious Diseases Society of America has been doing an amazing job with these living recommendations, or these have been some amazing guidelines that they've been putting out. One we talked about was treatment. Another one was on infection prevention, infection control. This last one is looking at diagnostic tests. So, as we know, accurate molecular diagnostic tests are necessary for confirming a diagnosis of COVID-19. Now, direct detection of SARS-CoV-2, a nucleic acid in respiratory tract specimens, informs patient, healthcare institution, and public health level decision making. So the numbers of available SARS-CoV-2 nucleic acid detection tests, or what we refer to as the PCR tests, are thankfully rapidly increasing, as is the COVID-19 diagnostic literature. So the IDSA recognizes a significant need for frequently updated systemic reviews of the literature to inform evidence-based best practice guidance. Now, their goal was to develop an evidence-based diagnostic guideline that's going to assist clinicians like us with our decision-making processes so as to understand the optimal use of these SARS-CoV-2 PCR tests. In the end, the panel agreed on 15 diagnostic recommendations, and I'll try to summarize their findings. In short, unimpeded access to accurate testing is critical for patient care, hospital infection prevention, and of course the public response to the COVID-19 pandemic. Thus, testing is recommended for asymptomatic individuals with known or suspected contact with COVID-19 cases. Testing asymptomatic individuals without known exposure is suggested when the results will impact isolation, quarantine, PPE usage decisions, if it will dictate eligibility for surgery, or inform administration of immunosuppressive therapy. The guideline panel used a methodology that rigorously was critical with respect to appraising the available diagnostic literature and formulating these testing recommendations. But ultimately, prioritization of testing will depend on institutional specific resources and the needs of different patient populations. I urge you to please have a look at these guidelines. They will help to inform you of your clinical decision-making process that you experience in your clinical practice. So lastly, let's talk about some good news. And these are some updates on some clinical trials. So again, good news about treatments. An article in The Lancet revealed that a triple therapy of interferon, beta-1b, ribavirin, and the old HIV antiretroviral lopinavir-ritonavir actually shortened the duration of viral shedding in patients with COVID-19. This was a phase 2 randomized trial that took place in Hong Kong. The triple therapy was given to those that presented within 7 days of symptom onset. The control group just received lopinavir and ritonavir. Patients in the treatment arm not only had a shortened viral shedding, they also had significantly shorter symptom as well as shorter hospital stays. So this study is being repeated in several countries around the world to determine reliability of these results. So another clinical trial good news is another drug called anakinra, and this is a recombinant interleukin-1 receptor antagonist that is used to treat rheumatoid arthritis. And in a recent article in Lancet Rheumatology, a small retrospective study in Italy compared high-dose use of anakinra with those that were not given the drug. Those that were given the drug had a higher survival rate at 21 days and a faster recovery of C-reactive protein levels. But I would like to reiterate, it was a small trial, it was retrospective. So the commentary that accompanied this article was that these results are promising, but exploratory. Still, I will take any good news whenever I can. So please stay on the lookout for our regular updates, and to read more from sources that were used in this report, please go to the acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and to stay on top of this crisis. And please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together.